Today I'll be talking about osteoarthritis in cats, a very common skeletal condition that affects their mobility and comfort as they age. Osteoarthritis is a disease of the bones, osteo, and joints, arthro, and the suffix itis means inflammation. So osteoarthritis literally means inflammation of the bones and joints. In cats, this condition develops when the smooth cartilage that protects the ends of bones, called the epiphysis, wears down. This leads to pain, stiffness, and changes you may notice in your cat's behavior. Sometimes x-rays reveal lytic changes or areas of bone breakdown around the joints because it is a chronic condition. It develops slowly over time, but your cat may also experience acute flare-ups of pain. You may notice muscle atrophy, which is wasting of the muscles, because cats in pain use their legs less. Cats with arthritis often struggle with normal flexion and extension of their joints, meaning they cannot bend or straighten their legs fully. They may also have trouble moving their limbs inward, called adduction, or outward, called abduction. This is why many arthritic cats stop jumping on counters or climbing stairs. To understand how veterinarians describe arthritis, it helps to use anatomical terms. The cranial side of the body is toward the head, while caudal means towards the tail. Dorsal refers to the back, while ventral means the underside or the belly. When describing limbs, proximal means closer to the body, while distal means farther away. For example, the arthritic changes are often in the distal joints of the legs, like the hock or the stifle. On the paws, the terms change. Palmar refers to the underside of the front paw, while plantar refers to the underside of the back paw. Cats with arthritis may show changes in how they use these areas of their feet to bear weight. Osteoarthritis is often bilateral, affecting both sides, but sometimes it only affects one side, called contralateral, to the normal leg. Pain may also shift from the medial side, or inside of the joint, to the lateral side, or the outside, as the disease progresses. Diagnosing feline osteoarthritis usually involves a physical exam and imaging. Cats can be difficult to diagnose as they try to hide their discomfort. Their small stature helps them endure the pain a bit more than a larger animal like a dog. Their agility also allows them to be nimbler on their joints. Veterinarians like for the owners to fill out questionnaires about their cat's behavior at home to narrow down points of pain. In some cases, an arthroscopy, which is a small camera inserted into the joint, can be used, though this is less common in cats. Treatment focuses on long-term management. Veterinarians may prescribe pain relief, which can be given orally or by intramuscular injection. Other treatments include joint supplements, weight control, and physical therapy to help atrophy and maintain mobility. At home, owners can make changes to support their cats, like providing ramps, soft bedding, or litter boxes with low size. While osteoarthritis cannot be cured, it can be managed to keep cats comfortable and active for as long as possible. Thank you for watching this educational video on feline osteoarthritis. Understanding this condition helps owners recognize the signs and provide the best care for their cats. Please read the final slide for my references and list of terms used.